Let's see about oxygen dissociation curve. Now, before coming to the topic, let's see about the structure of hemoglobin briefly, then we'll move on to the oxygen dissociation curve. Now, the structure of hemoglobin, as we know, it is a tetrameric protein which has 4 polypeptide chains, namely alpha chains and beta chains. So, 2 alpha, 2 beta, making it a 4-chain molecule. Now, the hemoglobin structure has a protoporphyrin ring, which is this, and an iron atom which is in the ferrous state, that is Fe2 plus, here in the center. Now, each ferrous atom can bind to 1 molecule of oxygen. So, the hemoglobin has 4 ferrous, so it can bind to 4 molecules of oxygen. Now, let's briefly see the different types of hemoglobin before we move. So here the change is only in the beta or globin chains. The alpha always almost remains constant. So now we have 3 types of hemoglobin. One is hemoglobin A. This is the adult hemoglobin and the most common hemoglobin. So here this constitutes around 96 to 98% of hemoglobins, and it has 2 alpha and 2 beta. Now, coming to the next one, that is HbA2. This is also an adult hemoglobin. It is constituting in around 2 to 3.5% of population. Here we have 2 alpha and 2 delta. Here it was 2 alpha, 2 beta in HbA. HbA2 is 2 alpha, 2 delta. Now, this is increased in beta thalassemia cases. Now, coming to the last one, that is fetal hemoglobin. This, as the name suggests, exists only in the fetal period. Now, here we have 2 alpha chains and 2 gamma chains. This appears at 6th week of period of gestation and lasts until 4 months of age. Now that we have understood the structure of hemoglobin and the different types of hemoglobin, let's move on to the main topic, that is the oxygen dissociation curve. Now, coming to the oxygen dissociation curve, as the name suggests, it is a curve, which means it's a graphical representation. Now, what does it represent? We have the partial pressure of oxygen compared with the hemoglobin saturation. Now, let's discuss. For any diagrams, keep it a point to always note the axis, what the axis represents, and very important, the unit that it represents. Now, in the x-axis, we have the partial pressure of oxygen, which is in millimeters of mercury, and the y-axis has percentage saturation of hemoglobin with oxygen. Obviously, the unit is percentage. Now, this is a normal oxygen dissociation curve. Now, the first question that comes is, why is this in this particular shape? First, what is this shape called? This is a sigmoid curve. Why is it sigmoid curve? As we saw, the hemoglobin has 4 iron molecules and that binds to 4 molecules of oxygen. Now, the hemoglobin rests in 2 states. One is T state and one is R state. So this T state is what you guys are right now, that is tensed state. The R state is what I am right now, that is relaxed state. Now, in tensed state, when you're tensed, you can't absorb any knowledge. Same way, for a tensed hemoglobin, it cannot accept hemoglobin, or rather, the oxygen affinity is low. Relaxed state hemoglobin, it's a very relaxed. You can consume lots of knowledge. Same way, the hemoglobin has higher oxygen affinity. So now, this sigmoid curve occurs due to a phenomena called cooperative binding. That is, we have 4 molecules of hemoglobin, one molecule of hemoglobin binding to 4 molecules of oxygen. Now, when the first molecule of oxygen goes and binds to the tensed state of hemoglobin, the configuration changes to relaxed state. Now it can accommodate more hemoglobin. So that is why first we see a period of inertia, then we see a rapid upslope, then a plateau, and this is where we call it 100% saturation. That is, the hemoglobin has attached to 4 molecules of oxygen, that is, it is fully saturated. Now, a normal graph showing ODC curve. Again, read the axis first. X-axis has partial pressure of oxygen. The unit, if not mentioned, always make it a point to note it down, millimeters of mercury. Y-axis, percentage saturation of hemoglobin with oxygen. Always learn the full forms of the parameters. The unit, correctly, it is in percentage. Now, the sigmoid curve, here 2 graphs are shown. One is of adult hemoglobin and other one is of fetal hemoglobin. Now, there is one more point when it comes to these ODC curves, something called as P50. Now, what is P50? This P is called the partial pressure of oxygen, which is always represented in x-axis, when the saturation of hemoglobin is 50%. That is, when the pulse oximeter reaches 50% oxygen saturation, what will be the partial pressure of oxygen in the blood? That is the definition of P50. Now, coming to the adult hemoglobin, the normal P50 value is approximately 26 millimeters of mercury. For a fetal hemoglobin, the P50 value is approximately 19 millimeters of mercury. Now, that is why we say fetal hemoglobin has more affinity to oxygen than adult hemoglobin. The reason being, the P50 of fetal hemoglobin is less than that of fetal hemoglobin of P50 of adult hemoglobin. Now, what does this mean? Now, for a given saturation, that is 50% of partial pressures, this fetal hemoglobin gets saturated at 19 mmHg. That is, when the partial pressure of oxygen slowly increases from 0 to 19, that is enough for a fetal hemoglobin to be 50% saturated. Whereas for adult hemoglobin, the partial pressure has to increase from 0 to 26. So, when a compound is getting saturated at lower pressures, which means the affinity for that molecule is higher. Same concept applies here also. Now, let's go. Next thing what we see is, why did we learn about this P50? Now, this P50 is the main important factor based for the successive slides. Now, why does P50 relevant? Now, when we see, when the P50 moves to the right, that is, when the P50 value is more than 26, we tell the oxygen dissociation curve has shifted to the right. Or when the P50 value has shifted to left, we can say when it's shifted to left, when the value falls below 26. Now, look at this diagram. Here, we have a yellow curve, which is a normal curve. Now, this red dotted line represents the curve shifted to the right side. We can correctly see the P50 is more than our normal adult hemoglobin value, and the violet dotted line shows the curve is shifted to the left side and the P50 value has fallen below 26. Roughly here, for arbitrary value's sake, we are mentioning it as 20. Now, what are the factors that causes the shift, or why is this important? Now, in tissues, when the oxygen is low or the carbon dioxide content is high, the oxygen tends to be offloaded from hemoglobin to the tissues. Rather, oxygen is being delivered to the tissues. This happens at tissue site. Now, coming to the lung side, here partial pressure of oxygen is more, carbon dioxide is less. This leads to oxygen uptake. by hemoglobin. So these factors, the curve getting shifted to left will result in oxygen uptake, and the curve shifting to the right would result in oxygen offloading. With this concept, let's move on to the factors. See, there are various factors which shifts the curve to left as well as right. I have a very easy way to remember this. No offense to the left-handers, but mostly all of us are right-handers. In a class, if we ask how many right-handers are there, majority are right-handers, right? So they tend to have a higher point, or they tend to be higher in number. So let's concentrate on the word high. So now here, see, shift to right. High hydrogen ion concentration, which is acidosis. High temperature, which is hypothermia. High carbon dioxide, which is hypercarbia, and high 2,3 dpg levels, and also high altitude. So everything was high, causing the shift to right. Two other drugs to be remembered is inhalational anesthetic agent, which is isoflurane, and the beta blocker propranolol. Now, no offense to the left-handers, but the shift to left, remember, low in numbers, low. Now, low hydrogen ion concentration, which is alkalosis, low temperature, which is hypothermia, low carbon dioxide concentration, which is hypocarbia, and low 2,3 dpg levels. Now, all the abnormal forms of hemoglobin almost always shift the curve to left. So, the fetal hemoglobin, carboxyhemoglobin, methemoglobin, and carbon monoxide inhalation, all of them shift the hemoglobin to the left. So in an exam, when you see any abnormal hemoglobin, you can be confident that it shifts the curve to the left. But one thing has to be kept in mind, the mechanism why the curve is being shifted to left is different in each of them. Let's come to that at a later stage. Now, we saw the structure of hemoglobin. We understood why the shape of the oxygen dissociation curve is sigmoid. And then we understood what is P50. Then we saw what is shifting of a curve to left and right. What does it mean? And what are the factors that affect, or causes the curve to be shifted to left and right. Now let's come to the most important effects, that is Bohr effect and Haldane effect. Now, again, a very simple trick to understand or remember what is Bohr effect or Haldane effect. So let's be honest, like even the most experienced people sometimes have confusion in these topics. So very easily, let's try to remember this. Write down both the names, Bohr and Haldane. And we have two gases in discussion here. One is oxygen, one is carbon dioxide. Now, whichever has this O has an end effect on the structure starting with O. So, the Bohr effect, the end gas that is getting affected is oxygen, and for Haldane, the end gas that is getting affected is carbon dioxide. Now, who will affect this oxygen? This carbon dioxide. And who will affect the carbon dioxide? The oxygen. At this understanding, let's go in further to have a good understanding of these Bohr and Haldane effect. Now, this Bohr effect, as suggested, as we learned, the effect of carbon dioxide on oxygen. So, the Bohr effect has effect on oxygen. Who brings about this effect? Carbon dioxide. Now, Bohr effect, what happens? Similar thing what we saw before, at tissue level, when carbon dioxide is high, or when there is high protons or there is acid, there is offloading of oxygen. Rather, there is decrease in oxygen affinity, or there is oxygen delivery. All these three things mean the same. Now, at the lung level, we have reduced carbon dioxide or reduced H+. This results in uptake of oxygen or increase in oxygen affinity. So this phenomenon that happens at both lung and tissue is known as Bohr's effect. So Bohr's effect was simply the effect of carbon dioxide on oxygen. Now the opposite of this would be Haldane effect. Let's see what is Haldane effect. Haldane effect is effect of oxygen on carbon dioxide, because carbon dioxide is the end gas that is getting affected in this. Now let's see. Again, there is a graph here, but it was different from before. Let's define the axis first. X-axis, we have partial pressure of carbon dioxide here, not oxygen, which is in millimeters of mercury. And the y-axis, we have carbon dioxide content. Now, what is carbon dioxide content? The unit is given here. That is milliliters per 100 milliliters of blood. That is how much ml of carbon dioxide is there in 100 ml of blood. Now, let's take a common point to see this phenomenon. Let's stay at a partial pressure of 50 millimeters of mercury. Let's take these two values and compare. At this red graph, we have the carbon dioxide content as 30 ml per 100 ml of blood. And the blue graph shows 40 ml of carbon dioxide per 100 ml of blood. Now, what do we understand from this? The Haldane effect says the oxygenated hemoglobin has lesser affinity for carbon dioxide. So now you would have guessed this red is the oxygenated hemoglobin. Naturally, it has taken up only 30 ml of content of carbon dioxide per 100 ml of blood. Now, it also states it means this difference also. If oxygenated hemoglobin can bind less or have less affinity for carbon dioxide, deoxygenated hemoglobin binds to more carbon dioxide. So this blue line represents deoxygenated hemoglobin, and it at the same partial pressure of 50, if a deoxygenated hemoglobin was present in the absence of oxygenated, the carbon dioxide content would have been 40 ml per 100 ml of blood. Now that we have seen Bohr effect and Haldane effect, let's see another important aspect of this, double Bohr and double Haldane effect. Now, where does double Bohr and double Haldane effect occurs? As you have guessed, for that you need two people, and two people existing at the same point sharing the same blood happens in mother and the fetus. So at the maternal placenta, we have the mother's arteries that is coming, that is spiral arteries and the uterine veins, and the fetal blood supply, that is the umbilical artery and the umbilical vein. Now quickly let's see what happens in double Bohr and double Haldane effect. All right. So here is the curve. Let me just zoom it. Yeah. Now here you can see, first let's label the parts to know what the diagram represents. Here we have the maternal arterial blood, and here we have the umbilical arterial blood. Now let's start the discussion with this. Now, maternal arterial blood, when it comes to the placenta, it is rich in oxygen and low in carbon dioxide. So now what we told, what does the Bohr effect do? Bohr effect affects the oxygen, but what affects the oxygen? The carbon dioxide. Okay. So the carbon dioxide, and in the umbilical arterial blood, which comes from the fetus to the placenta, there is increase in carbon dioxide and reduction in O2. Now, this reduction, that increase in carbon dioxide facilitates the atmosphere, which is enabling the maternal arterial blood to cause a rightward shift. So that is the first Bohr effect we see, that is the rightward shift. So we discussed what happens if the oxygen dissociation curve shifts to the right. There is offloading of oxygen. That is what we want, right? The fetus should get oxygen and nutrients from the maternal blood. So it offloads the oxygen. Now, by doing this, the oxygen gets combined with fetal hemoglobin. Now, what is Haldane effect? Haldane effect was the final effect was on carbon dioxide, and who brings about the carbon dioxide effect is oxygen. So oxygenation of the hemoglobin causes dissociation of carbon dioxide from the fetal blood. And then here, next what happens is, after the rightward shift and offloading of oxygen, now there is offloading of carbon dioxide due to Haldane effect from the fetal side. That carbon dioxide increases in the placenta, which causes the second Bohr effect. Now here what happens is, the umbilical arterial blood comes with high carbon dioxide and low O2, and because of the changes, it leaves the carbon dioxide there and takes up the oxygen released by maternal arteries. Now this causes a leftward shift of the fetal hemoglobin for increased affinity of oxygen. That is the double Bohr effect happening, and Haldane effect as the same, because the effect is on carbon dioxide, there is less oxygen, it is more affinity to carbon dioxide happens, and after leaving the oxygen to the fetus, the maternal hemoglobin now has more affinity of carbon dioxide. It takes the carbon dioxide and returns back to maternal circulation. So this was double Bohr and Haldane effect. Let me make it a little bit more clear with this diagram. All right. So this side we have the maternal side, and here we have the fetal side. Now coming here, maternal blood comes with high PO2 and less PCO2. Fetal blood comes with high PCO2 and reduced PO2. All right. Okay. So here maternal side artery, that is the uterine artery, and the spiral artery is the end of the uterine artery. So that carries oxygenated blood, and the umbilical artery here gets the deoxygenated blood. Artery carrying a deoxygenated blood, is it correct? The nomenclature was usually based on the flow of blood from or towards the heart. Anything that carries blood away from the heart was labeled as arteries, and those bringing blood to the heart were called veins. So technically, umbilical artery carrying deoxygenated blood in fetal life is correct, because from the heart it is getting the deoxygenated blood to the placenta in the maternal circulation for its oxygenation. So let's not get confused there. Let's concentrate on the Bohr effect here. All right, coming here, Bohr effect on oxygen. So here in the maternal hemoglobin, there is, the environment has high PCO2 brought in by the fetal hemoglobin. Now what happens? The affinity reduces, oxygen dissociation curve shifts to the right. First shift happens in the maternal hemoglobin. So oxygen goes from mother to the fetus. Now second shift, because of this second Bohr effect is always effect on oxygen brought out by the carbon dioxide, correct? So here there was rightward shift. Here in the fetus it happens is leftward shift of fetal hemoglobin. So how does the leftward shift happen? Because the carbon dioxide is let out by the fetal hemoglobin here, affinity to oxygen increases, which causes the leftward shift. So first shift, second shift, double Bohr effect. All right. Now similar way for the Haldane effect. Haldane effect is the effect brought on by the oxygen on the carbon dioxide. So end result is carbon dioxide, and who brings about is oxygenation or deoxygenation of hemoglobin. Maternal hemoglobin, it deoxygenates. So increase in affinity for carbon dioxide. Here oxygenation of fetal hemoglobin happens, then there is reduced CO2 affinity. So CO2 dissociates from fetal hemoglobin and gets transferred to the maternal side. So this is what is called double Bohr and double Haldane effect. Let's come to the last part of the video, that is myoglobin and hemoglobin. Now the starking difference between two graphs. We said the hemoglobin dissociation curve was sigmoid. What do we call the myoglobin dissociation curve? That is hyperbola. The reason for sigmoid dissociation curve was the cooperative binding, 4 molecules being present, all being in tense state, then converted to relaxed state, all that. In myoglobin, no such confusion, only one molecule, So when the oxygen comes, it just binds. Now, let's see the P50 of myoglobin. So what was P50? That was the partial pressure of oxygen at which the saturation was 50%. So let's take 50% saturation, and we know the normal P50 for adult was 26 millimeters of mercury. Now, for myoglobin, it is somewhere close to 5 millimeters of mercury. So now who has more affinity to oxygen? Myoglobin. Now let's just quickly see about myoglobin, fetal hemoglobin, adult hemoglobin. Now compare the P50 values to understand the affinity. Myoglobin was 5, fetal hemoglobin was 19, adult was 26. So the oxygen affinity is highest for myoglobin, followed by fetal hemoglobin, followed by adult hemoglobin. This concludes the discussion. Thank you.